Happy Friday from Beverly Hills. Wanted to share an interesting case while I'm going for a walk between patients. 25-year-old female who we had seen yesterday for a dry eye consult. We were her fifth opinion. Patient has previously been put on a number of pharmaceutical eye drops for dry eye, as well as 4 sessions of IPL. She wasn't sure which device was used, but not helpful. That was with corneal shields and manual expression. 1 session of LipiFlow, no improvement. 8 sessions of tear care, no improvement. 2 sessions so far of radio frequency. 2 of 4 have been performed, no improvement. Now, she's generally healthy, no major medications that she's on, and she has been tested for Sjogren's negative. We're also going to run some other tests on her, recommend her to have some other blood work done. But upon evaluation, I had noticed that she had lid wiper epitheliopathy. She had never had BlephX performed, so I highly recommend that. Her previous doctor had mentioned that when they perform expression, it's very difficult. They have to apply a fair amount of pressure. And when the oils or meibum do express, it's thick and yellow. So what that indicates is that she'd likely benefit from having BlephX, Optivise, and likely probing. So probing is high on my list of procedures that she benefit from despite only having mild to moderate gland changes. She's never been on Accutane. She has not used Latisse, but she has been on tretinoins for the last 2 or 3 months. So I recommended and advised her to discontinue using tretinoins, as we know those can be difficult for dry eye patients to continue with. She did have ICL surgery sometime last year. Seemed to make no change in her dry eye symptoms. She would have loved to have worn contacts before her surgery, but her dryness was so severe that she was unable to. So at least her vision is improved after the Visian ICL refractive surgery, but her eyes still feel very uncomfortable. And as a 25-year-old, she's unemployed, unable to work, very difficult to watch TV and movies. So it's really impacted her quality of life. And so our hearts go out to patients like this and who suffer from patients of all ages, both genders, and all ethnicities. So we're here to help when patients are really struggling, and we hope that patients don't have to go through all these various procedures with failure after failure. It really affects your mental wellness, and you start to lose hope. But we're really here to be that safety net, and we don't give up. We'll do our best to help patients get to where they need to. And her brother was the one who initially booked her appointment because he hates to see her suffer.